The following presents information for how to get help for a loved one with a mental illness.
If you or someone you know is having a mental health crisis, call one of the numbers shown for Chester County, Delaware County, Montgomery County, or Philadelphia. Or if there is immediate danger of physical harm, call 911.
These crisis lines provide 24-hour-a-day, 7-day-a-week access to staff who are specifically trained to deal with mental health crises. Receiving their help may reduce the risk that a mental health crisis will result in an arrest. Someone is available 24 hours a day, 7 days a week to assess the situation, arrange for an in-person evaluation, and or to make a referral as needed.
Now we'll present an overview of how to get services once the crisis has passed. Individuals with good private health insurance can find excellent care from private providers. Many individuals with severe mental illness will find it helpful to apply for publicly supported services, including disability income from the Social Security Administration, Medicare and or Medicaid health insurance for disabled individuals, and community mental health services.
The Social Security Administration, or SSA, determines who is eligible for disability income. Low-income disabled people who have not worked or paid into Social Security may be eligible for SSI, or Supplemental Security Income. People who have worked and paid Social Security taxes may be eligible for SSDI, or Social Security Disability Income.
Applying for disability income can be difficult, and many people are rejected initially. It's a good idea to understand the guidelines before applying so that all required information is included. You can call the Social Security hotline for pamphlets that explain the benefits and rules for applying for disability. You can also get information and apply online at www.ssa.gov. For additional help, you can contact the Disability Rights Network, which offers free services to help clients obtain SSDI or SSI.
Now we'll take time to talk about publicly funded medical insurance. Medicaid is a federal and state government program that provides health insurance coverage to low-income persons if they meet income and resource standards and other eligibility requirements. People who have SSI are automatically eligible for Medicaid. If you live in Pennsylvania, you can apply for Medicaid online at www.compass.state.pa.us or by going to your local county assistance office. In Southeastern Pennsylvania, most people who have Medicaid must enroll in a managed care program called Health Choices and must use designated behavioral health vendors for mental health and substance abuse services.
Medicare is a federal program that provides health insurance to Americans who are over age 65 or those who are younger than 65 and have long-term serious disability. People who receive SSDI must wait 2 years from the date they were determined to be eligible for SSDI before their Medicare coverage becomes effective.
Now we want to take time to introduce you to information about community mental health services. At your intake appointment, you should be assigned a doctor who will oversee psychiatric care and prescribe medications, and a case manager who will assist in planning for daily needs, setting goals toward recovery, arranging day treatment services, group or individual therapy, vocational and employment services, housing, or whatever is needed for the rehabilitation of your loved one. There often is a long wait for housing. Sometimes an intensive case manager goes with you to appointments and other services you need. Otherwise, it is a good idea for a family member to help you get services.
If you have Medicaid and want to contact Community Mental Health Services, call the number for your county in the table shown here. If you do not have Medicaid and would like to have community mental health services, go to the website shown here and click on the How to Get Services link, which provides additional information about all of the topics discussed thus far. In addition, you can find information at this website about Family to Family, which is a free course for people who have a family member with mental illness. And you can find our resource guide for suburban Philadelphia area with additional information about benefits and behavioral health services, support groups, and opportunities for socializing, volunteering, and employment for individuals with mental illness. For additional information, you can also call 267-251-6240.
If you are a U.S. citizen who lives outside of southeastern Pennsylvania, you should feel free to call the Mental Health Crisis Counselor at 1-800-273-8255, 24 hours a day, 7 days a week. You may also get in touch with the National Alliance on Mental Illness. Their website is www.nami.org. You may also call NAMI's Information Helpline at 1-800-950-6264, Monday through Friday from 10 a.m. to 6 p.m. Eastern Standard Time, as well as you may email NAMI at info@nami.org.